Your mental health challenges have a root cause. You need to figure out what's causing the symptoms before you decide to pop a pill. Medicating is only going to cause more problems. Why is it when the symptoms of our health problem include our thoughts, behaviours, emotions, we don't take a look at the organ responsible, the one between our ears, our brains? We simply medicate according to a label dictated in a diagnostic manual. Our brains and our bodies are intimately connected. The vagus nerve is the longest running nerve in your body. It goes from your brain throughout your torso. It's connected to all your different organs, your reproductive system, and out to your limbs. Vagus is actually Latin for wandering. It wanders throughout your body. The health and functioning of your vagus nerve, it's known as the vagal tone, is an important body of study these days, because the vagus nerve is part of the reason why so many physical aspects that are going on in your body end up affecting your brain. But instead of looking at the root cause, your doctor's going to look in the DSM, the Diagnostic and Statistical Manual of Mental Disorders, and diagnose you according to symptom clusters, which are basically scientifically meaningless. A study of the latest DSM-5 was carried out in Liverpool in the UK, and they raised some alarm at this practice back in 2019. They showed there's 24,000 possible combinations of symptoms for panic disorder. There's various diagnoses where two people could share the exact same label but have zero symptoms in common. And there's so many overlapping symptom clusters that two doctors could come up with completely different diagnoses for the same patient. Symptoms are the body's cry for help. We can't separate psychological conditions and mental health from a biological or physical health. Brain inflammation is the common denominator in everything from Parkinsons to multiple sclerosis, epilepsy, Alzheimer's, schizophrenia, bipolar, and even depression. The prescriptions handed out for mental health conditions are some of the worst products out there. Take depression. SSRIs are given out like candy these days. Drugs like Prozac, Paxil, Lexapro, and Zoloft. They're basically based on the marketing, heavily marketed theory that depression is due to a chemical imbalance of serotonin in the brain. The problem is the actual science fails to show any connection between depression and serotonin levels. When you're depressed, the amount of serotonin doesn't necessarily drop. The picture is far more nuanced, with serotonin involved in so many processes in your body, such as mitochondrial energy production, metabolism of sugar, your immune system. Drug trials of antidepressants are barely distinguishable from a placebo. 30% of those not taking the drug show improvement in their symptoms, while over 50% of those on the drug don't. And of course, Big Pharma has an answer for why a particular drug doesn't work for you, of course. They came up with the label treatment-resistant depression, telling you you just need to add a second drug to your regimen. Ka-ching! So the drugs aren't working, and you have all sorts of side effects: weight gain, insomnia, reduced libido, bone density loss, an increased risk for breast cancer and dementia, suicidal ideation. Isn't that what it's trying to prevent? So maybe you decide to stop the drugs. What they don't tell you is how addictive they are, downplayed by Big Pharma as discontinuance syndrome, very unpleasant side effects of trying to taper off SSRIs, such as dizziness, nausea, headaches, and brain zaps. These are like an electric current running through your head, and many people are just unable to stop these drugs because of this debilitating side effect. We'll look at other psychiatric drugs in other videos, but you might say, well, what's the alternative? Well, it depends on the root cause. One of the biggest is nutrient deficiencies. Your brain is the most greedy consumer of nutrients in the body and is often the first to show problems when it's not getting what it needs. If you're on other medications, for example, they can be causing deficiencies like in B vitamins, in magnesium, a big driver of depression. Did you know that schizophrenia was recognized as early as the 1950s as a form of pellagra, a massive deficiency in vitamin B3, niacin? They were getting people out of psychiatric hospitals by giving them large doses of niacin, and they become entirely normal. Niacin is a really critical vitamin after vitamin C, vitamin D, because niacin is converted to a substance in the body called NAD, which is involved in over 400 different gene functions and so many different processes in the body. Toxins is another root cause for brain and health. Maybe it's from ultra-processed food and all the additives and preservatives and chemicals they're laden with. Perhaps it's something in your environment, maybe your workplace, something in your home, maybe it's mold or the furniture or some paint, something like that. There's various chemicals and the medications themselves to make them shelf-stable and absorbable in the body. Your microbiome is critical to your brain working well. That vagus nerve is the central expressway between your gut and your brain. If the good bacteria in your gut is impaired, they're not making enough of the neurotransmitters that your brain needs. Your microbiome can be damaged through toxins, through stress, through medications like antibiotics. Even that one course of antibiotics you took a year ago can be gradually leading to mental health problems you're having now. You need to fix your microbiome, maybe through eating fermented foods, taking high-quality probiotics, for example. You might have food sensitivities causing your brain inflammation. Maybe it's from the food dyes. Maybe it's the MSG in your Chinese takeout. Maybe it's gluten, which has been linked to so many health problems that may not manifest themselves as digestive in nature. Maybe your health challenges are actually due to a metabolic disorder or thyroid problems. Alzheimer's is starting to be called diabetes type 3 because it's got a recognised connection to blood sugar management. It could be a disordered immune system, maybe due to an underlying infection like Lyme disease. I could go on, but you get the gist, right? You need to figure out the root cause and not just pop a pill, which is going to create a cascade of further problems and lead to just further ill health. If you pick one priority for the year, you've got to get your employees off the mental health drugs. You're not helping them. There's a whole lot of employee-focused solutions to provide the support that's needed that also addresses while they're getting the physical and biological root causes addressed. Employers are generally embracing these other solutions like Spring Health, Lyra, and Mind. There's a whole bunch of them. But you've got to make sure that they're not also hearing messages to go see a conventional doctor and pop a pill. If you're subsidizing these drugs, you're really only adding to the problem. Employees need to get educated, and I wish these mental health solutions were doing more to warn about the dangers of pharmaceuticals, but they're stuck in a fairly conventional mindset themselves. It's a big topic, and we'll come back to it in later videos. Until then.